Members, good morning. The meeting of the panel on health services is the last for this term. Since the last meeting, there's been no information paper issued. Today we have two items on the agenda. One is on measures for the prevention and control of coronavirus disease 2019 in Hong Kong. Maybe we could invite the administration to join us. Yes, we are on this item. You could press the button if you wish to speak. You could do so now. Yes, press the button to speak. Now for the first item for discussion, that's some measures in relation to COVID-19. And then the other item is also very important. It is about breast cancer screening. I understand many members have been following up on the issue for some time now. So for each item, we are going to allot 1 hour. I would like to give more members a chance to speak, so I will limit each member to 3 minutes. Okay? I'm sure you have all received an updated background brief issued by the Secretariat this morning. Now, may I welcome Professor Sophia Chan, Secretary for Food and Health, and other relevant government officials. Thank you for joining us. Now, apart from the Secretary for Food and Health, we have Ms. Leona Lee, Dr. Wong Kah-heng, Controller, Center for Health Protection, Dr. K.L. Chung from the Hospital Authority, Dr. Vivian Chuang from the Hospital Authority, Mr. Tommy Yun from the Constitutional and Mainland Affairs Bureau, and Ms. Wong Yin Yi from the Social Welfare Department, and also Dr. Verena Lau from the Education Bureau. First of all, Professor Chen, can you take us through the paper? Thank you. Good morning, Chair. Good morning, members. Now, on the latest epidemic situation of COVID-19, well, it started to stabilize in May and June. In mid-June, there were a streak of 21 days without any local infected cases. But then there's been a sudden change of event recently. Between the 2nd and 8th of July, there's been an increase of 31 new confirmed cases. These are cases without a travel history during the incubation period. And then as at 4 p.m. on the 9th of July, we have a total of 1,366 cases. Now, as I said in the press conference yesterday, on the advice of WHO and experts in Hong Kong, we know that before there is effective treatment or vaccination, the disease is not going to go away, so the situation remains serious. And with resumption of activities and flow of people, we expect the epidemic to remain in a state of flux. And we'll be seeing local cases from time to time, and that's within what we expected. Now, we have various immigration measures, and then we also have a contact tracing measures, testing measures, and so on. Hopefully, through these measures, we are able to contain the epidemic within a level with which the public healthcare system could cope. And then if there are any changes in circumstances, we could respond swiftly. Now, for any prevention and control measures, they must be targeted. The primary objective is to prevent the spread of the disease. And then where it is safe, we should also resume economic and social activities. Now, having considered the impact on the public healthcare system and the impact on the public, we adopt the suppress and lift strategy. And we have regard to the latest development in the epidemic, and we're taking new prevention control measures. On social distancing, yesterday, we have gazetted new directions under the Prevention and Control of Disease Requirements and Directions, Business and Premises Regulation, CAP 599F, to tighten social distancing measures. This covers catering businesses and specified premises, and there is a cap on the seating capacity. There are also other prevention and control measures. Under the new directions, starting from they will come into effect on the 11th of July for 14 days until the 24th of July. On catering businesses, there is a cap on the number of customers. It cannot exceed 60% of the usual seating capacity of the premises, and there cannot be more than 8 persons at the same table. For bars and pubs, there cannot be more than 4 persons to a table. We will continue to enforce other restrictions on scheduled premises. Now, for activities conducted without wearing a mask, there will be a limit on the number of people. Is reduced from 60 persons to 8 persons sharing the same room, and that covers fitness centers, party rooms, karaoke establishments. For nightclubs or clubs, the number of persons at a table, the number of customers allowed is not more than 60% of the normal seating capacity, and there can only be 4 persons to a table instead of 8. For cinemas and places of public entertainment, no drinking and eating is allowed. We will also maintain other restrictions in relation to special premises. And because of the clusters we've seen, we're going to do targeted testing. We will cover staff of residential care homes, catering businesses, and also drivers of public transport. We want to identify asymptomatic patients so there could be early identification, early isolation, and early treatment. That way we can cut off the transmission chain as soon as possible. We work together with the Social Welfare Department and Transport Department, and then we arrange for private laboratories to carry out tests for the catering business and the public transport business. And we will also be offering advice and support in this regard. Now, finally, I would like to appeal to the general public to observe personal and environmental hygiene. We must raise our alertness, and together we can work to reduce transmission in the community. Today, I and my colleagues are happy to answer questions from members. Thank you, Madam Chair. Thank you. 50 members have pressed the button. We have only 1 hour for this item, so for members who have not yet pressed the button, please come down and press the button. After 50 minutes, I'm going to draw the line. Perhaps I could ask the clerk to read out the names of the 50 members. Professor Joseph Lee, Ms. Alice Mack, Dr. Elizabeth Kwok, Mr. Michael Tian, Mr. Ray Chen, Ms. Kay Chen, Mr. Pun Xiu Ping, Ms. Claudia Mo, Mr. Wilson O, Mr. Roy Kong, Dr. Fernando Zhang, Mr. Yu Si Wing, Mr. Xu Ka Chun, Dr. Helena Wong, and Dr. Lo Wai Kwok. Okay, I'll open the floor to questions first. Professor Joseph Lee. Thank you, Madam Chair. I have a number of questions about the epidemic. Now, this is the 3rd wave of transmission, and we are seeing a community outbreak. Experts have been pointing out this all along. The ideal testing capacity of 7,000 to 7,500 tests a day, but I don't see any commitment on the part of the government to do that. And then private laboratories and private hospitals have pledged they would help out. Though, can you achieve that target? If you can't, how many tests do you expect you can do? Because the expert is saying that this is the safest level. So can you say something about the testing capacity? Second question is for the hospital authority. Now, this morning, hospital authority representative said that you have 1,200 isolation beds, and but then in recent months, there's always malfunctioning of negative pressure rooms, and that's really scary. It could lead to problems. So how do you make sure that your beds could be put to proper use? Third question. It seems that you have not announced your PPE stock level for some time now. So is there enough stock? Would you limit the use of PPE? Would people have to reuse PPE even if it's become wet? And what about the N95? What about the model? You haven't resolved the matter, and you haven't resolved the issue about the fit test. So these are outstanding issues that have not been resolved. So what are you going to do? Because there are complaints from staff. Another question is about residential care homes. We're seeing an outbreak, and that's worrying. In the past, the elderly and residential care homes have been the neglected groups for all these prevention and control measures. Even for PPE, you just leave it to these home operators. You don't help them. Now we are finally seeing an outbreak. So Professor, you, the Department of Health or the Social Welfare Department, how are you going to help the elderly? How are you going to protect them? And how do you train the staff there to make sure they do a proper job in prevention and control? Thank you. Professor or Secretary? Now, first, in response to Professor Lee's question about testing, and then perhaps the hospital authority could answer the questions on the HA, and then the Social Welfare Department could take up your question on the residential care homes. First, about testing. This is very much the priority of our prevention and control measures. We have so far done 384,000 tests. So per million population, that means more than 51,000 tests. Of course, we keep increasing our capacity. In terms of the capacity and the scope of testing, we've been expanding that. Let's first talk about the number of tests. Professor Lee referred to the figure 7,500. Actually, by the end of this month, we will be able to achieve the target of 7,500. Actually, on certain days, we exceeded the capacity of, for example, the past 2 days or today, we've exceeded 7,500. We're doing some 7,800 tests. So why we are able to achieve the daily target of 7,500 by the end of the month? I'm talking about the public sector, because for the private sector, we are not able to gather enough information to know their capacity. We have a rough idea, but we don't know the exact capacity. Now, for July, on average, in the public sector, we do about 4,000 plus tests per day. And then by the end of the month, because under the Anti-Epidemic Fund, $220 million have been given to the Department of Health, the Hong Kong University, and the Chinese University, so they could procure more equipment and hire more staff to do the test, and there will be an additional capacity of 2,400. So by the end of the month, we could achieve the target of 7,500 tests per day. And of course, there is also testing in the private sector, and we'll try to obtain the accurate figures. Now, about the scope of testing now, Madam Chair. Now, people with symptoms of mild symptoms, we test them. But then starting from May, we started testing high-risk groups without symptoms. We've been working on different groups, and we've done some 9,000 tests, and all tested negative. And of course, we continue with the community testing. Now, now that there's an outbreak, you see that the Department of Health would immediately give out specimen bottles to the places of work or the buildings where the confirmed cases live, so we could do tests accordingly. Please watch the time. There are over 15 members waiting to speak. As the chair said, we only have 3 minutes for question and answer, so please be brief in your reply. Now, can we have ask the next member to speak, and then perhaps the hospital authority could come back to give an answer later on? Well, maybe they can give me a written reply. Ms. Ellismack, well, I have many questions, but I think this latest outbreak shows that there are probably asymptomatic carriers of a virus in the community. Now, in Beijing, they have full population testing. That is an effective way to identify patients. Can we do the same in Hong Kong? Now, the Secretary told us just now you will be increasing the capacity of testing, but have you ever considered asking the medical teams from the mainland to come and help us with testing the entire population? Well, on testing, I think Dr. Wong Kah-hing can speak in a moment. Our testing is a targeted approach. Now, especially now that we have an outbreak, we want to reserve our testing capacity for persons related to the outbreak. But then we know in the private sector, they also have certain testing capacity. So we will look at targeted groups such as staff members in the catering business, staff working at residential care homes or taxi drivers and so on. We will be doing tests for them. Now, I don't have much time, so I must say this. The Secretary stressed that because of the limits in capacity, that's why we need to target certain groups. So I fully appreciate that. But if we can have assistance from the central authorities, they send us medical teams, and maybe we can do tests for the whole population. Because when you do tests for the whole population, you will gather information that may help you to put in place the health code sooner. Because we're talking about the people with needs in Hong Kong residents here. They're not able to go back to the mainland. This health code scheme has dragged on for so long. At the same time, we see there are asymptomatic carriers of the virus in the community. So the best thing is to test the entire population. If we can't do it here in Hong Kong, can we not look at the practice in Beijing and Wuhan? They're doing the same. So maybe we can ask the mainland medical teams to come and help us. It's not something that's difficult to do. So have you ever considered it, or maybe you never consider it? You just want to rely on your own. You will try to do things within Hong Kong's abilities. Is that your mindset? No, actually, we welcome assistance. Now, we've been trying to find out the capacity in the private sector. By private sector, we're not just talking about private hospitals or private laboratories. We understand there are other people, including mainland companies, who may want to come to Hong Kong to provide testing service, and we welcome that. The Department of Health and the Food and Health Bureau have been in discussion with them all along to see how we could expand our testing capacity. Next, Dr. Elizabeth Quat. Thank you, Madam Chair. Now, on testing for the entire population, in Wuhan, they tested all 9 million people. And in 10 days, they were able to test over 6 million people. In Hong Kong, our testing is slow, is insufficient, and is expensive, and the health code is not yet out after all this time. So we could take advantage of the experience of Wuhan, and they have cheaper testing kits too. Then maybe in Hong Kong, we could substantially boost our testing capacity very quickly. So I hope the government will consider it. Don't say no so soon. If we just rely on market force and on the private sector, really, there's no way we could address the situation in Hong Kong. Now that we have the third wave of outbreak, people are really worried. In the past 2 days, I received many inquiries, mostly from parents. Parents are really concerned about their children going to school. Some parents are saying that they will stop their children from going to school starting from next week. They will just apply for leave. So in that case, can schools, start a summer break sooner? All at once, because parents think the government is being irresponsible, they are leaving it to the schools to decide. So perhaps the government should come to a decision soon and announce it. Now, of course, we're also very worried about public transport, buses, minibuses, taxis. There are many cases involving taxi drivers now. So the public believe that all drivers of public transport should be tested as soon as possible, and all vehicles should be disinfected. And because there is this photocatalyst coating, maybe the government should subsidize operators to do that. And should the government require drivers and passengers all to wear a mask, because some don't wear a mask. And if taxi drivers won't take a passenger with a mask, he may be actually the subject of a complaint for refusing a hire. So, and then people are also very concerned about group gathering. How come for religious gatherings or for theme parks and so on? What is really the justification? leave them to decide whether to continue operation. And then for bookware, there should be a limit on the number of people, and people must be required to wear a mask. Secretary.
Any effective ways that can help us to increase our testing capacity, we will not rule them out. We want to have more testing capacity so we can know exactly whether there are any invisible transmission chain in the community. That's our target. So we will work towards this goal. On your second question, I will invite a colleague from the Education Bureau to answer. Please turn on Dr. Lau's microphone. Schools can make consideration based on the progress of students. If they have sought approval from the governing body of the school, they can start the summer holiday according to their original schedule. We know that the epidemic is still developing, so we will continue to communicate with the CHP for relevant measures. Chair, the parents think that the government's anti-epidemic measures are lacking. So if you need the schools to hold meetings, we will have to wait again. So I think the government should take up the responsibility to make a decision rather than leave it to the schools. Mr. Michael Tian. Thank you, Madam Chair. Chair, this week we have an outbreak again, and the situation is not optimistic. Yesterday, people in the catering sector still opposed the government's prevention measures and said that economic activities is very important. I am baffled. Are people's health not more important than the economy? I have 3 questions for the Secretary, and many of them have to do with the experts' opinion. In May and June, all people exempted from quarantine and giving deep throat saliva sample when entering Hong Kong, there were 30,000 to 40,000 of them each month. They are walking around in the community without giving deep throat saliva samples. And a few days ago, you said the crew members on flights need to give deep throat saliva sample. So how many crew members will be subject to this test? So the Port Health Control Office should have the figure. I don't have the figure right now. No. You ask the crew members to give saliva sample. So among the 40,000 people, only they account for only 3,000. But what about the others? They can come in freely. Mr. Tian, we don't have the figure right now, but we can provide the figure to you later. And second, the CHP has announced that among the people exempted for quarantine, some of them would leave very soon. So it makes no points to take their saliva sample. It's all right. I need the figures. Taking away all those who are just staying briefly, what is the figure? At least give me the figure in June. We need to reduce the number of people exempted. Maybe no exemption should be given at all. It is very efficient for people to give saliva sample. I don't understand why you need to exempt them. It is a test and go measure rather than test and hold measure. I know you can't hold them for 6 hours, but what about test and go? Why don't we extend the test and go measure to all people? And second, home quarantine is only mere talk. There are many loopholes. People are sharing toilets. In Chunyang Estates, the housing authority said the first phase, future tenants, 4,000 of them will not be able to will be allowed to move in August. So we hope that in July we can have more quarantine centers. The Architectural Services Department has provided 800 extra space in Penny's Bay. What if the spaces are not enough? Are you going to consider hotels and cruises? Of course, we will think about other options. So you will consider hotels and cruises. We will consider appropriate options. Mr. Ray Chen. Thank you, Chair. 2 questions. Under 599, concerning high-risk premises, there are a lot of restrictions. If people violate them, they will be subject to prosecution. But has the government set up guidelines concerning internal government operations? For example, I was arrested on the 1st of July. Around 200 people were arrested and brought to into custody in North Point Police Station. It was in a car park. Everyone was sitting close to each other. There was no distance at all. We stayed there for 30 hours. We could not wear masks because we needed to eat there. And half of the police officers were not wearing masks as well. The risk was high. Can the Secretary give a direction for these high-risk government premises? After being released, I spent $2,000 on doing a nasal swab test. I was tested negative, so don't worry. There may be police station outbreak or person in custody outbreak because there are no guidelines and no awareness at all. And also on notification of confirmed cases. Are we going to receive updates at 4:30 at 4 p.m. each day concerning the area of outbreak? Even after the announcements, there would be new figures at the night. This morning, Secretary, you were not able to tell the latest figure to the public. In Lake Yuen Estates, there was an outbreak last month. There was a rumor that there was an outbreak in Huoche, but in the end, it was clarified that it was Lake Yuen. But you made the announcement at 4 p.m. If you knew the situation the previous night, could you not notify the residents more promptly so that they can make preparations?
Thank you, Mr. Chen, for your questions. We will soon review this internal arrangement, as you mentioned. Now, we have the department responsible for auditing the internal measures. Next, Dr. Wong could answer your question on the announcement arrangement. Thank you, Mr. Chen, for your question. Of course, we're all very concerned about the epidemic, and we have a mechanism every day. We follow closely the development. Now, there may be confirmed cases, there may be preliminary positive cases. And because we expect cases to go up, so the Department's health and the hospital authority, laboratory colleagues are all working very late. And every day is at 4 p.m. that we draw the line. So for 4 p.m. the day before to 4 p.m. the day, that's where we draw a line, and then we'll give figures for this 24-hour period. Either we announce the figures at the press conference, or we just issue a press release depending on the situation. Because, but then, as you said, we keep doing the tests continuously. And for some confirmed cases, they may first be preliminary positive cases. Could you make an announcement once or twice more frequently during the day? Well, because our colleagues need time to at least do some preliminary epidemiological investigation, so we have some initial information. We want to avoid confusion. So the better way is for us to first compile the information before releasing it. Now, and say if there is a need to carry out any prevention control measures, for example, if there's a preliminary positive case, we need to send the patients to the hospital, we do it at once, and so it doesn't affect our immediate prevention control measures. Next is me. Now, you asked me to describe the infection. We are talking about widespread community outbreak, and the virus keeps mutating. Because you have announcement on how quickly the disease multiply, or the virus multiplies in the upper respiratory tract, and so what you need to do must be prompt and swift. But it seems that you're reacting rather slowly. I must pick up on what Dr. Wong Kar-heng said. Yes, I know you only announce your test results at 4 p.m. every day, but then today, in the news already, there are at least 10 preliminary positive cases in Shui-Chun-O essay. We asked you, you can't give us answers. And then even schools have received a notice from the Education Bureau that students have been confirmed positive, and so classes have to be suspended. Why is it that then the CHP cannot give any information sooner? Must you wait till 4 p.m.? Just now, there's a parent group saying that they just received a notice that they have to go and pick up their children. So, how long will you wait? And you say because there is an outbreak in catering industry, so you will first work on that taxi drivers. But what about schools? We are seeing outbreaks in school. How long do we have to wait? I have 2 children myself. Originally the summer break has been pushed back, and they've only just taken the final exams, and then there is the TSA. And then the schools will decide next week when to resume class, and then that's the day when they will do the DSA. So must you insist on not suspending classes altogether? Over 10 schools have suspended classes, so what are you waiting for? That's why I say you're being slow and your decision is wrong. Another question is about the taxi cluster, the care home cluster, and the eatery cluster. There are many cases of unknown sources of infection. You say you have to do. We say you have to do more tests, but actually at Shenzhen Hospital, at the Shenzhen branch of the Hong Kong Hospital, the doctors have offered to help. They can do 3,000 tests for you. So why don't you accept their offer? And then we could try to do more tests, and especially with cases with unknown sources of infection. Then you could take more samples from community. If there are actually more infected people in the community. But you're not doing that. So can you please respond to all my questions? I will quickly respond to your questions. The first one about the notification system. Well, as Dr. Wong explained a moment ago, now, there is a timetable for the Center for Health Protection to make announcements. And, of course, we know that people would like to find out about the confirmed cases sooner. But as Dr. Wong explained, they have to, verify information. They don't want to give out information that's not been verified. So we'll see what we can do to do better. And then second question is about the Education Bureau. We will give advice to the Education Bureau, and we will look at the overall situation. We're not going to rule out class suspension or other measures altogether. The Department of Health will liaise closely with the Education Bureau. Thank you. Well, there's no need to respond, but it's my view. If there are already confirmed cases, already this morning, 2 schools received notice that their students have been infected. So why can't you issue the information? Why do you have to wait till 4 p.m. or the 4:30 media briefing before you tell the public? You don't have to wait till 4 p.m. to make the announcement. We're talking about widespread outbreak in the community. Since there are already confirmed cases, and then schools have been informed to suspend classes, so these are not the probable cases mentioned by Dr. Wong. So you should immediately give out the information for the public. Next, Mr. Poon Xiuping. Thank you. Well, the transmission of this latest outbreak is quick, and if we can't find the sources of infection, that's really worrying. And we have seen infections among taxi drivers and in residential care homes for the elderly. So it seems that we have plenty of asymptomatic patients in the community. Now, I have 2 questions. Recently, I received views from union on non-emergency service staff. Now, they help with, they talked with the department, with the hospital authority about their PPE as they escort patients to and from, say, residential care homes for the elderly and so on. And so we're talking about a non-emergency ambulance service. Now they're only given 2 to 3 masks a day, and now with this outbreak, and of course you have tested them. You have tested most of the patients. They are negative cases, but then they may become positive later. So shouldn't they be issued with the N95 masks like what firemen get? And then for these non-emergent frontline officers, well, because it's so hot, their masks become really wet. But then they only given 2 masks for every 3 trips. Now with this serious outbreak, unless the authority tells them that they are really short on PPE, otherwise shouldn't some flexibility be exercised, and then you could give more assurance to these frontline staff? Hospital authority. Dr. Chuang, thank you for Dr. Chung, thank you for the question. Now about the masks used by staff, we have about 3 months of supply for surgical masks and the respirators, that is N95. So we'll have regard to the guidelines and see whether staff need the N95 respirators or the surgical masks. Now, we never ask our colleagues to reuse their masks, so there's no cause for worry. And it depends also on the needs at work. Now, now is the weather is hot and masks may become wet, so we'll ask staff members to replace their masks. And now that you've mentioned it, we will go back and take a look. We'll make sure that there is a sufficient supply of masks for our staff. Now, it depends on the plasters. So you mean it's not limited to 2 masks per 3 trips? No. You mean as long as it's wet, then they could be replaced? Yes, we've always asked staff to replace the wet mask. So in that case, I don't know why they're complaining. Mr. Wilson, can I ask the Secretary and your team to consider this? This is already a community outbreak. Yesterday, there were 42 cases, and life is really tough for the public. Every day I go to meet with residents in the community. They are really worried. But then every day we have to wait till 4 p.m. before you announce new cases. So should you not streamline your process so people could get information sooner? And there is still much room for coordination among departments. I always complain that you're being slow in reacting to circumstances. Yes, you have done a lot, but it's important that you have better coordination in the release of information. That's important because now the public don't know who to trust, and maybe the management office in the building has say something, and then media say something else, and then the government say something different again. So you need to do better coordination on release of information. As for the distribution of specimen bottles, just 2 days ago, I really complained hard about pink check assay. On the first day, you only brought over 300 bottles, and only the next day that you gave 1,500 bottles. And then on TET assay and others, they still not receiving any bottles. Choi Fei assay, Yao Tong assay, they've not been receiving the bottles yet. So is there any criterion to go by? That is, you must dispatch the specimen bottles within a certain number of days, because the residents still asking for the bottles. And testing quota, can you not increase the quota soon? For you mentioned the Children's Hospital and University, you say you ask them to help, but what about speeding up the test? We are talking about major outbreak. If you don't do more tests, people will be even more scared. And then for residential care homes, there's a serious problem. Contract homes, licensed homes, and whatever. They are taking their care, they take up about 50% of the A1 bought places, but they don't have enough protection. Yes, the homes need to be responsible for that, but can the government do more? And for residents, it's hard for them to get masks. So can you do something to resolve this matter? I will first ask the CHP to answer the question on distribution of specimen bottles. I know they're trying their very best, and then the Social Welfare Department. Thank you, Mr. Orr, for your question on distribution of specimen bottles. Well, that's part of our epidemiological investigation in an outbreak, because we're trying to identify cases. So we are giving out the specimen bottles to a wide spectrum of people. But as Mr. Orr pointed out, we are seeing a sudden turn of events with this outbreak, and we have many different spots involved. So there is a much higher demand for specimen bottles. And of course, we have limited manpower, so we're doing our very best. Now, with so many cases, it takes time for us to give out the specimen bottles, but we'll work as quickly as we could. And there is no such thing as a quota. If there's a need, we will be giving out bottles to all those who need them. And as you say, we are in a critical stage of the epidemic, and we expect cases to go up further in the near term. So we appeal to the public to observe personal protection, to do proper personal protection. They should keep a social distance, and they must wear a mask. Social Welfare Department, thank you for the question. For residential care homes, in the past few months, since January, the Social Welfare Department has done much to support residential care homes. I'm talking about all types of residential care homes for the elderly and for others, and including homes with bought places, as mentioned by Mr. Orr. Now, starting from January, we have given subsidies in 4 rounds to home operators to buy special protection equipment and take other protection measures. In the 4 rounds, there were 4 rounds, and for the first 2 rounds, each unit has $5,000 and $3,000, and then for the third and fourth round, it's $6,000 and $10,000 respectively. For the latest round, we've already written to the operators on the 9th of July. As for protection equipment, since January, we've been providing masks to residential care homes around the territory. Now, for homes, starting from March, the government has been providing 2 million masks each month to all these residential care homes. Next week, we're going to distribute another round of masks. So we have distributed 11 rounds of masks so far. We have distributed 10 million masks for staff members. As for residents of residential care homes, starting from next week, for residential care homes for the elderly and the disabled, we are going to provide 4 million masks to the residents there, because from under the guidelines of the CHP, residents may have to wear a mask under certain circumstances. So we would make sure that there are masks for use by residents as necessary. So we will be distributing masks next week. And we've also given a subsidy for spraying the photocatalyst coating for all licensed residential care homes that are eligible to apply for this subsidy. And we have asked homes to do the spraying as soon as possible, hopefully before August. I think for the other information, you could give it in writing, because we've overrun. Next, Mr. Roy Kwong.
He's not here, so next, Dr. Fernando Cheung. Chair, one of the outbreak happened in a residential care home for the elderly. This is very worrying. Such an outbreak is very dangerous because fatality among elderly people is very high. This is the case in the SARS episode. So there are several things worrying about this outbreak. According to the guidelines provided by CHP to residential homes for elderly and disabled persons, the staff should avoid working in different care homes. But many workers from foreign places will be deployed to different homes. The Kong Thai Care for the Aged Center may have this issue. So how will the social welfare department prevent such things from happening again? Have you paid a visit to the hostel for imported labor under the supplementary labor scheme? This scheme is still ongoing under the epidemic. If we continue to import labor from the mainland, then I'm very worried that they would be carrying the disease. The living environment is extremely crowded. I have been to their hostels. They are sleeping in bunk beds, and it is extremely dirty. There are even cases where two people sleep on the same bed. They work in different shifts and they share the same bed. And there are also ad hoc shifts. They may be working at many care homes. I don't know how the social welfare departments can tackle that. The 14-day home quarantine is just a joke, given the crowded environment. Let's look at the environments of this care home. The elderly people will not be able to leave the home, and because of the epidemic, no visitors are allowed. So the elderly people are trapped inside and no one can visit them. So what will happen to their mental state? Even a normal person will get depressed. How are they supposed to live on? What measures do you have to help the residents? I would like to remind colleagues, the 3 minutes include questions and answers. So I would invite the Social Welfare Department's colleague to give us an answer. Thank you for your question. On supplementary labor scheme, according to my understanding, imported labor under this scheme has to work in specified location. So they will work for the care home that employ them. And there are certain standards in relation to the accommodation provided by the employer for the imported labor. On residential care homes concerning visitors, we have issued guidelines together with the CHP for residential care homes for elderly persons and disabled people. Because of the epidemic, no visitors are allowed. And we have reminded operators of care homes that they should facilitate communication between relatives and the residents, including telephone calls and video calls. So we will continue to encourage the operators to do that. Next, Mr. Xiu Ka-chun. Thank you, Chair. To the Secretary, since the epidemic, have we reached the darkest days? To me, it had happened. That is an outbreak in residential care home. I have a question for the Social Welfare Department. Many members are talking about all population testing. But the situation is very bad. In residential care homes, there are only 3 quotas for testing for each care home. and it is up to the care home to decide which 3 colleagues will receive a test. With this outbreak, you are not doing more. Now, with this outbreak, I want to ask the Department of Health, what is the testing scope concerning this outbreak? Do all the colleagues in both residential care home receive a test? Do the colleagues working in Wingfart building get a test as well? If not, why and when will they get a test? Kong Tai and the other centers colleagues need to be quarantined. So who will be responsible for taking care of the residents and their rehabilitation? Will the government intervene in providing care and rehabilitation for the residents? I sent a letter to the Director of Health on the 7th of July concerning visiting arrangements and epidemic prevention concerning care homes, but I received no reply. So, Secretary, would you please press the Director to give me a reply? I understand that you are very busy, but this is something that we are very concerned with, and I think our concerns will help you. These questions are related to the Social Welfare Department, so Ms. Wong, please. Thank you, Chair. There are several questions. About the letter sent on the 7th of July, we will reply you ASAP. In May, we have worked with the Departments of Health to arrange for testing under enhanced laboratory surveillance scheme for the residential care homes. So in the future, we are going to give tests to staff and residents in residential care homes. We will give the care homes testing bottles to test the staff and residents. Concerning quarantine measures for those in Kong Tai Care for the Aged Center, the government has commissioned the Hong Kong PHAB Association Jockey Club PHAB camp as a quarantine center. So we have arranged other staff to take care of the residents there. Chair, I was asking a very important question. Will all the staff and residents in those centers with outbreak be given a test? Because there are only 3 quotas given to each care home, so will all of them be tested? Dr. Wong? We will look at the results of the investigation and decide who need to be tested. I believe all staff and residents in those centers with outbreak will be tested. But it depends on the cooperation of the residential care homes for tests to be carried out. And it also depends on when we receive the samples. If we receive a sample in the morning, there will be a result soon. But if we receive the sample late, there will be a late result. So all of them will be tested. But what if the care homes do not cooperate? Then they will be given no test? Or then a test may not be given immediately. It depends on the actual circumstances. But I believe all of them will be tested. Next, Dr. Helena Wong. Chair, about suspension arrangement for schools. The Secretary said she could not rule out a possibility of suspension. But it is not clear whether the decision will be made by the schools or the Food and Health Bureau, or we will just leave it to the schools to make a decision. When parents or students fall ill, the schools will suspend school for 1 day or 2 days. It is up to them to decide. So you are providing no leadership. Chair, it's not the case. We will make reference to our risk assessment. And we will look at how we would tighten social distancing measures based on that. On suspension of schools, the CHP has been working together with the schools. There will be certain guidelines when schools are resumed. The epidemic is still developing, and we are having more confirmed cases. So we will issue our guidelines, and the Education Bureau will make considerations as well. We will work together on this. So what are the criteria? If someone is confirmed, the school should suspend. We are amidst a community outbreak. We are having an outbreak, and the schools are suspending schools on their own. Madam Chair, what I said was the Departments of Health and the CHP have been issuing guidelines on schools. When there are confirmed cases, schools have to be suspended. If there are close contacts, they will be sent to quarantine centers. In order to reduce people traffic on the society and social distancing, this is what we will do. Well, it seems that we are just asking questions to the air. We receive no answer. Well, in the press briefing, they mentioned about the criteria on suspension of schools. It's all right. I don't think I will get an answer. What about testing? The government said they will increase the number of testing. So testing provided by the public and private sector. What is your target? What is your daily target? Madam Chair, we have been gradually increasing our testing capacity and scope. What is your target? Earlier on, we have procured some equipment. By the end of this month, we can have 7,500. This is our target if the epidemic stabilizes. But now we are having an outbreak. Yesterday, our capacity has reached 7,800, and we are going to exceed this number. We are going to increase the capacity gradually if there are more outbreaks. There are outbreaks among catering businesses and residential care homes and taxi drivers. These are targeted groups, and we are going to provide tests for them. Next, Mr. Kwong Chun-yu. For those who just come in, we have 3 minutes for questions and answers.
Yes, Mr. Roy Kwong. Yes, there's another meeting next door, so I have to go between the two meetings. I'll be very quick with my questions. Next week, there'll be the book fair. Secretary, maybe some members have already asked about it. Now, it's Friday already. I'm worried that you may all of a sudden decide to cancel an activity. Then for the publishing sector and the cultural sector, they will be, making a complete loss, suffering a complete loss. And so people don't know what to do now. They cannot be sure. Now, we have a minor outbreak. Well, I wouldn't say a minor outbreak. Actually, it's an outbreak. Next Wednesday, the book fair is to start. Now, you have tightened certain measures, but you still allow the book fair to go ahead next week with over 10,000 people possibly going in and out. Or maybe you try to decide to scrap the event in the next day or two. What about compensation for the exhibitors? No one knows what's going on. Now, another question, maybe it's nothing to do with the secretary, because the Carrie Lam's government has wasted a lot of money in the epidemic fight. Now, you wasted $800 million on the CU bars, you distributed it, no one used it. And then recently it's been exposed that there is poor hygiene with the surgical masks that you gave out to people. So what's going on with the Carrie Lam government? And then Now, the media have exposed hygiene problems with the masks bought by the government costing some $1.5 billion. So how to explain that? Professor, Secretary? Well, for book fair and other events or theme parks, they are licensed as places of public entertainment. So they will have to follow the licensing conditions. Now, first of all, everyone must wear a mask. And secondly, an appropriate distance must be kept. Under 599G in Schedule 1, we have scheduled premises, and there is exemption for gathering for these premises. So for the book fair attendance number, it will not be subject to the group gathering restriction. But then there are directions given to places of public entertainment. So in other words, there cannot be more than 60% of the normal capacity, and then for a number of persons at the table cannot be more than 8, and so on. So these are the things we will do. And I understand the host organization is proceeding with great caution. It's issued a series of guidelines, and we have given them advice on the guidelines. So we want to make sure that they take a proper public health measures. Next, Dr. Lo Wai Kwok. Thank you, Madam Chair. We've seen a spike in local infection cases. There's been expectation among the general public and in particular the professional sector that the health code scheme will be rolled out soon. And so there will be mutual recognition of the health code of the Guangdong, Macau, and Hong Kong. Now, there are people who actually have to travel for work or for other reasons, but that's sort of activities that come to a complete halt. So there's been expectation, but then with this sudden spike in infection cases, people are totally disappointed. Of course, we cannot keep the epidemic under control. There's no point saying more. But I want to know whether the government is still pushing ahead with the health code scheme. And would there be a solution to the problem of people who need to cross the boundary? And many have pointed this out too. For Macau and the Guangdong authorities, the cost for obtaining the health code is much smaller in dollar terms, but in Hong Kong, it's so expensive that means only bosses could afford to take the test, and so many are complaining. There has to be a solution there. In particular, when there is still a community outbreak, how can the government do more tests on an extensive scope? And importantly, you need to make sure the tests are affordable. Well, we have colleagues who could give you an update on the progress. Yes, Dr. Low, the administration has heard the views of the public, especially the relevant sectors, on traveling among Guangdong, Macau, and Hong Kong. That's almost completely stopped, and there is far-reaching implications. Now, we've never stopped discussion with the two other authorities on the mutual recognition of the health code or test results. We have done much, as the Constitution and Mainland Affairs Bureau. But then you must appreciate this. If we, we have to make sure the epidemic is more or less stable before there could be mutual recognition of a health code. So we fully appreciate the demands of the relevant sectors. And we will continue to do our best in doing all the preparations, such as the arranging for sufficient testing capacity and so on. So when the epidemic situation stabilizes, then we could proceed immediately. Mr. Tommy Cheung. Well, just now, a colleague said that he heard from the catering sector that they oppose to the tightening measures. They want to focus on the economy as if the economy is more important than the health of the public. And he shudders at hearing that. Well, in that case, I will invite him to read new media reports today. Now, this promotion campaign was worked out more than a month ago when, in response to the government's cash disbursement scheme. And yesterday we said we would see whether we proceed and whether there's need to make adjustment. Now, in March, when the epidemic was at its peak, restaurants have been promoting takeout meals, giving 30% or 20% discount. Well, maybe not everyone is not all the restaurants are as well off as Mr. Tian. They could just shut the door and not do any business. In any case, it is not the responsibility of catering businesses to look after the health of the public. Of course, if we become a media for spreading the disease, we have a responsibility there. That's why we are very careful about that. But anyway, and can I ask you, the Secretary? I read from the newspaper today, I think it's Professor Yuen Kwok Yung, who said that there is no economic benefit or it is not cost effective really to test the entire population. I care very much about economic benefits and cost effectiveness. And then the Secretary said yesterday the government adopts a suppress and lift policy. I'm not against the suppress stage now, but I hope in future there will be the lift stage too, equally. I don't know if I read the report wrong. Now, Professor Yun said if someone is not feeling well and you do the test, maybe you will only identify one asymptomatic patient out of 10,000, so the cost is high. But then if there are people who are not well, let's say they suffer a cold or a flu, and you test them, maybe it will be a lot more cost effective. Maybe you will identify one patient out of 500 tested. Now, for now, of course, the test is too expensive. It's several $1,000s. It's not possible to test the entire population, even if the government would fund it. And the second question, of course, is you don't have the capacity to cover the entire population. And so the government is considering specific industries like my catering industry or perhaps the taxi industry, because there have been clusters arising from these economic activities. So how do we look at the whole issue as we try to offer protection to the public, and at the same time we want to make sure that the tests are cost effective? So what is the balance there? Secretary, a brief response, please. Well, there's always been a limit on our testing capacity, and that's why all along our focus has been, as you mentioned, Mr. Tommy Cheung, on people with symptoms or mild symptoms. The Secretary believes that it's the most important for us to test these people. And then it will be easiest to identify confirmed cases among people tested in this group. Of course, if there are invisible transmission chains, you may have to do many tests before you could identify a carrier. We know that's the case in terms of statistics. Now there is evidence to show that there are indeed invisible transmission chains in the community. Now for people without symptoms, that is asymptomatic carriers or invisible transmission chains, we know there have been many studies around the world proving that's the case. Now some time ago, we tried to test high-risk groups of people without symptoms or with mild symptoms. We did about 9,000 tests. That's a tier 7 test. And all the test results were negative. So as I said, we may have to do many more tests before we could find asymptomatic carriers. But of course, now we know there is a community outbreak and there are invisible transmission chains. And Dr. Wong has been saying that repeatedly at press conferences. Now we know there are clusters now, and there's an outbreak and we know there are confirmed cases. So if we do tests in these clusters and those related to the clusters, then we can find out whether there is a transmission in that group, and then that will serve a purpose. Next, Mr. Holden Chow. Thank you, Madam Chair. It's unfortunate that there is a sudden spike in confirmed cases. So I know, Secretary, you will have to step up prevention measures again. But what I want to point out is that in certain districts, for example, Kowloon East, we have seen more confirmed cases. I know you are going to step up a disinfection and so on. But please do not overlook New Territories West. I'm sure you've heard from me. Just last week, there was a case, a confirmed case, that person lives at Long Ping SA, but he's not been back for several months. Even so, together with our district officer Tam Wai Lam, we distributed disinfectants. Anyway, residents would like you to step up disinfection in those areas. Please step up your disinfection effort. That's the first point. Secondly, the Secretary has announced a further tightening of measures, and eating establishments are going to take certain measures. We fully appreciate that's for the purpose of preventing the spread of the disease. But I must point out one thing. Different industries are already struggling, and now there's a sudden outbreak, and you're tightening measures again. Most importantly, for residents, many local residents have been looking forward to the health code. I hope you will still proceed with the scheme. We know there's an outbreak, there are new confirmed cases, and some worried, but I must impress upon you on this point that many people want to see the health code. They want the costs to be substantially reduced so that later on people will be able to go back to the mainland using the health code, because many families really are waiting for it. Either it's because of work or for family purpose. There are many in the grassroots sectors, they're really suffering and they're waiting for the health code. So I would like to take this opportunity to tell you this again. Secretary, please make sure that the health code scheme could be rolled out as soon as possible. Thank you. Secretary. Well, the representative of the Constitution and the Mainland Affairs Bureau just told you that there's the discussion with the mainland and Macau authorities has continued. Of course, there's fluctuation in the epidemic situation in Hong Kong, so we still need to discuss that with the other two authorities. But we've already put in place all the preparation. And of course, we hope that the cost of testing could be lowered further. We are still in discussion with private laboratories. Hopefully, when there's a bigger demand, that means more people will do the test, and then there's room to lower the fee with more competition. We know initially the cost would be around $1,000 to $2,000, but recently we know that tests are being offered at lower than $1,000. So if there are more laboratories joining in the market, then maybe the fees could be lowered further. Mr. Ari Lee, I'd like to follow up on the health code. The Chief Secretary of Administration originally promised to give a report to the House Committee today. To give us a report, but now the Secretary for Food and Health is here, so she's giving a report here too. Now, in the past 4 Health Committee meetings in the last months, many members across the spectrum have been expressing concern about the health code. Of course, there's a fluctuation in the epidemic, but then you must not stop your preparation work. And at least you could get started even on a smaller scale at the beginning. But then there's no way that we still don't see when this is going to start. Can you tell us whether it be this week, next week, or when? And another point is about fees. You say you're going to bring in more competition, but there is still we're not still seeing fees being lowered. So what can the public do? And the final point. Now, there's been fluctuation in the epidemic situation, and the government said it could give subsidy under the epidemic fund for deep throat saliva tests for certain industries. So did those industries approach you, or did you identify the industries yourself? There are many industries which could be considered high risk. Even us members, we come into contact with the public often. So what are the criteria for deciding whether an industry is a high risk or not?
Mr. Yun from the Constitutional and Mainland Affairs mentioned that we had not stopped liaising with authorities and preparation of the work. We are ready to implement the health cook scheme, but after all, we need a tripartite discussion on the implementation details. We will definitely not stop our preparation on that. We want to start the scheme as soon as possible and gradually adjust the number of quota upon discussion with the authorities. Because of the epidemic's fluctuation, we still need to have tripartite discussion about that. We are having an outbreak, so we need to be targeted. Most of our cases are residential care home residents, and there are outbreaks among catering businesses and also taxi driver groups. We don't want to make it compulsory, but our different bureaus like Transport and Housing Bureau and the Social Welfare Bureau will liaise with the catering businesses stakeholders. And with the help of the FEHD, we can implement the scheme. Chair, there have been mourners who were not able to go back to the mainland. So will they be given special arrangements like under the health code? There will be a written reply later. Mrs. Regina Ip, Chair, we have been worrying about outbreak in residential care homes. In the UK, in the states of Washington, in the US, the outbreak has started in residential care homes. But have we discussed about subdivided flats? These are very crowded places. I have paid many visits to these places. Residents share toilets. Now, you are subsidizing the residential care home, but what about subdivided flats? The students, the children are crammed on the same bed, and this is very dangerous, and the situation is very poor. And this is a miracle that there have been no outbreaks in subdivided flats. So what are you doing? What are you doing to help them? Madam Chair, concerning subdivided flats, we don't have a targeted measure to help subdivided flats residents. But we have started community testing in May for asymptomatic people of high risk. We have invited them to go to our 18 Chinese medicine training and research centers in the 18 districts to get a bottle. If they feel unwell, no matter how minor the symptoms are, they can go to our 60 general outpatient clinic. And we are going to step up publicity in this regard. When the situation has stabilized, even when we had the schemes in place, very few went to get bottle. When we have an outbreak lately, the number has been climbing up. So we will pay attention in this regard. Actually, the district offices can do more. The liaison officers, they should promote your scheme and encourage people to have a test and educate people on health matters. There are district offices in Sham Shui Po, Mong Kok, and the Southern District, and so on. They should be the ones to do that. We will take your views to the district offices. And also, there are many foreign domestic helpers returning. Now, they are employed by employers, but the infection rate among them is still unknown. Many employers are very worried. So what quarantine measures do you have to help the employers? Upon arrival of the foreign domestic helpers, we have 2 new measures for them. First, they need to be tested back in their origin countries, and they are only allowed to come if they are tested negative. And upon arrival, we do not recommend them to stay at the employer's home. They should be quarantined in hotels. What about guest houses? Would they share toilets in guest houses? The Labor Department has compiled a list of hotels, and these are all hotels up to standard. Mr. Shilga Fai, do you need to take a break and let other members go first? I'm all right. It's just very near. I was having a meeting next door. Thank you, Chair, and thank you, colleagues in the Food and Health Bureau, the public could see that you have done a lot to strike a balance in balancing economic activities and health risk in the past few months. The simplest way is to close off everything. There will be no epidemic, but then the economy will crumble. People will not be able to make a living. So you have done a lot to put restrictions on the capacity of different sectors and scheduled reopening. So I would like to give my thanks to all that you have done. On prevention and control, and also on opening of borders, we are thinking a lot. In the House Committee last week, many members were talking about health codes and when borders will be opened. But we have had a few very disappointing days. Many people would like to come from the mainland, but now we are having new outbreaks. Honestly, I'm even more worried at this time because the outbreaks are of unknown sources. So I have been helping you to disseminate information on my Facebook to friends in my trade and appeal to them for the support of the government's tightening measures. Otherwise, there will be even more severe outbreaks. So that's my position. I would like to know what suggestions does the Secretary have for people in my business, what we can do to prepare. Thank you, Madam Chair, and thank you, Mr. Shiu. We are having community outbreaks. And the social distancing measures have been tightened in terms of retailing and other activities. The most important thing is people should keep their guards up, and the people in the trade as well. We need to maintain environmental and personal hygiene. The outbreaks we have this time are related to activities conducted without wearing masks, including restaurants. So our measures are very targeted. For activities conducted without wearing masks, they have high risk, and people should be careful. On one hand, we need to have economic activities and also a resumption to a degree of normal life. And we need to prevent infections. So I urge the public to wear face masks after eating. I understand that people would like to relax after eating, and I understand the weather is hot, but the public should be vigilant. They should not share tables with others. After the past 5 to 6 months, the Hong Kong people are more vigilant. Many people have booked the tables, but after the tightening of measures, they have cancelled their bookings. So these measures will continue, and we will keep up our efforts in terms of expanding testing capacity and scope to tackle the epidemic, and also to get a clear picture about outbreak and in the community. Next, Mr. Wong Ding Kwong. Thank you, Chair. In combating COVID-19, the Hong Kong SAR government has done a good job. Now the situation is fluctuating. When we saw a light at the end of the tunnel, we are feeling discouraged again. So I have a few questions. Many parents have been making queries to the pro-establishment camp, to the DAB. They are very worried about their children, whether they would get infected in schools. So, Secretary, have you considered recommending the Education Bureau to suspend schools? Second, I've received many queries from the trade. They thought things can be relaxed and many activities can resume because the epidemic has been easing out. There is going to be a book fair. This is an international event. Every year there are many visitors. Now people are very confused. Will the book fair be cancelled? Will there be restrictions? What will the situation be? Should they press on or should they hold it off? Many publishers are confused. And there's something that has been troubling us for a long time. For people who have a business in mainland, they were not able to go back for half a year. They could not they could not do business or sign business papers. They thought the health code was coming. They were willing to pay a fee. They just want to go back. But now we are having an outbreak again. So what is the source or reasons of the fluctuation or the resurgence of epidemic? Is it because many South Asian ethnicity people are returning, so they have brought the virus back, causing an outbreak again? Or was it because people were exempted? Is it because of the exemption for travelers from the Guangdong and Macau, so that they brought a virus with them? So, Secretary, media, there are media reports that the Education Bureau has made an announcement that there will be a suspension of school from today. So the Education Bureau is going to make an announcement concerning the latest developments concerning the book fair. We have tightened social distancing measures. So the CEDB is involved in that. But as far as I understand, there are going to be restrictions concerning distances between people and also the number of visitors. The CEDB is working on that. On health code, the Constitutional and Mainland Affairs Bureau representative said that there have been a tripartite effort on implementing the health code. But now, with the fluctuation of the epidemic, further discussion is still needed. But we will not stop our preparation work. Health code is already ready to go. Actually, the situation in mainland is very stable. So under CAP 599C, there have been 100,000 travelers coming from the mainland, and there was not a single confirmed case among them. So we will continue our discussion with the authorities about the health code in order to gradually open up traveling between the two places. Concerning this particular outbreak, the CHP is working hard to find the source of infection and also the close contacts to quarantine them. And there have been mass testing. In the past 2 days, 7,000 tests have been done. So, Mr. Wong, under this new normal, we hope the public can understand according to the experts and the WHO, the virus is going to stay. This is a new normal. So it is within our expectation that we have local cases. Like Dr. Wong said, we had to deal with the situation swiftly because there have been a lot of cases and they came quickly. So we will maintain our response ability to respond and also the capacity of our public health system.
Now, we've overrun by half an hour on this item, but many members are concerned about this item. So the last to speak would be Dr. Pierre Chen, Mr. Gary Chen, and then Dr. Priscilla Leung. But please, everybody, be brief. Dr. Pierre Chen. I would like to thank the CHP, the various parties, for working so hard in the past half a year to fight the epidemic on behalf of the people of Hong Kong. So first of all, my gratitude. Secondly, some members asked what is the source of the problem. I can tell you that. It has to do with rivals coming to Hong Kong who have to undergo mandatory quarantine. So the problem is with the schedules of 599C and E. Now, the epidemic is not yet an endemic. We only have cases imported. We don't have local cases so far. So that means when we have low cases, it's because there were imported cases. And then these imported cases then go on to pass on the disease to people locally. So it is not an endemic yet. So therefore, the problem lies with the exemption of certain people, groups of people. Now, just two months ago at the meeting of this panel, we talked about it, and then it's unfortunate that my prediction was right. Now, if you've been doing proper tracing, you wouldn't face this trouble. Now, even among the accepted group, if there's been testing and tracing, then you wouldn't see this problem. So I hope you will rectify that. Now, because of the community clusters, the Secretary said yesterday, you will step up testing, targeting residential care homes, restaurants, and drivers of public transport. But then Professor Yun Kwok Yung kept saying that we haven't yet achieved the expected capacity. You need to do more tests, the more the better. Now, the Secretary told us there's a chance of us reaching a capacity of 7,000 tests. So how do you plan to achieve that? Can you tell us? So how many tests do we have to do per day for us to identify the asymptomatic carriers? In fact, many of the confirmed cases involve patients who are asymptomatic. Now, you gave $200 million under the anti-epidemic fund to the Department of Health and to the universities on increasing the capacity of testing. Can you tell us where that $200 million have gone? So in other words, how have you spent that money? I'll just answer the key questions because I don't have enough time. On testing, we have earmarked $200 million for three parties: the Department of Health, the Hong Kong University, and the Chinese University. This is money for them to buy equipment and hire staff, so we could increase the testing capacity. Hopefully, by the end of this month, we are able to achieve 7,500 as the target. Because the additional testing capacity would be about 2,400. So by the end of this month, hopefully we could achieve this target gradually. You mean gradually is just to achieve 7,000 or 7,500? Yes, 7,500. That's what we want to achieve. Earlier we said that we want to test different groups, and we're talking about large numbers. For example, staff members of the catering industry, workers of care homes, and taxi drivers, and so on. If we want to test these groups, perhaps the public sector is not able to cope alone. That's why we would need to, tap into the private sector resources. But for the public sector, starting from May, we started community testing. The Hospital Authority and the Department of Health have already started community testing since May, and that's the Tier 7 testing level. And we have done some 9,000 tests. The results were all negative. So, but when cases are imported, how do you do the tracing? That's the most important. If you do a proper job there, then restaurants could remain open, people could go and play football, and people could work wearing a mask. So that's the very fundamental of the epidemic prevention measures. Yes, when anyone comes into Hong Kong, there is need for mandatory testing, but then you have exemptions. That's the problem. Yes, even for the exemptions, the majority of those accepted are the air crew members. But is it possible that they are not infected? Well, Dr. Chen, I've allowed you more time than others. Next, Dr. Priscilla Leung and Mr. Ben Chen, and then I really have to draw the line. So please watch the time. Dr. Priscilla Leung. I hope the media report is right. That is, the government has taken on board our views to suspend classes for all schools as soon as possible, starting from next week. Now, you announced the latest group gathering restrictions. I received over a dozen calls from parents in just an hour. So it seems that sometimes you are not looking at the whole picture. In fact, yesterday I openly demanded the Secretary for Education to announce a class suspension for all schools. I hope this is true. This is not just hearsay, I hope. Second question is on testing. Dr. Lo Chung Mao offered many practical suggestions. That is, that Hong Kong could work together with the mainland because their test kits are so much cheaper, and then we could do much more tests in Hong Kong. Have you followed up on those suggestions? Have you taken on board those suggestions? That I'm a layman. I called Dr. Low to seek his advice. Well, you know that in Hong Kong we've been doing rather well all along, but we've never been able to deal with the problem of families that's been separated, on the mainland and in Hong Kong. And then we have large number of arrivals from the UK, the US, and other places. And just now, a member mentioned South Asian arrivals. Now, in South Asian countries, there may be a serious epidemic, and so there's a high percentage of arrivals who are infected. And you didn't know that just because of we now have the third wave of transmission, you could see that coming. All our neighboring countries except the mainland. Now, I had to go to the mainland for business once, but it was all done so quickly. There were 3 or 4 tests on the mainland, and when I came back to Hong Kong, I had to do a test again. They did it all really quickly. So why can't we learn from their experience? It's something practical we must do. And now we have this new wave of transmission. All the activities have to be cancelled again, and for restaurants, certainly they will face economic hardship again. So, would you consider a third round of subsidy? Maybe not so much, maybe just $30 billion to cover groups that have not been covered by the previous rounds. There are many self-employed, there are hawkers and so on, like photographers. They are self-employed. They are not covered at all by your scheme. There are many who've been affected by the epidemic. Many, are self-employed, or even estate agents, maybe the agents are self-employed. They did not benefit from your first 2 rounds of subsidy. Now we see another wave of transmission. Activities are going to come to a halt again. So do something about them. And one thing I'm not happy about, now when you have relaxed the gathering bans, I've been to restaurants, but you have not been doing education at the same time. You're not telling people that epidemic is not over. Like after the relaxation of measures, when we are at a meal, for those who speak, they should wear a mask. For those who eat, they can take off their mask. That should be the measure taken. You took that very seriously at the beginning, but once with the relaxation of the gathering ban, nobody is practicing that in restaurants. Sometimes I felt embarrassed that I had to wear a mask when I spoke, but I felt embarrassed. I hope people could understand why I do that. So you have to make it comfortable for everybody. That's when for people who speak, they have to wear a mask. When people who eat, they can take off their mask. Otherwise, there will be so much saliva being spread. And then I'm telling you, everyone in a restaurant, is spreading droplets. And when I wore a mask as I spoke, I was told, well, you can take off the mask, no need to be so concerned. But I think you need to educate the public so people don't feel pressure when they have to wear a mask. Now we are seeing a third wave of transmission. I don't want this outbreak to get worse. So please, you need to be prepared. Already, restaurant bookings are cancelled, so people are going to suffer again. Okay. Even when you're speaking passionately, you have to wear a mask, right? No, yes, give $30 billion to this group. Mr. Ben Chen. Now, with this outbreak, again, people are very much concerned. Of course, public self-disciplined. They want to help the government in controlling the epidemic, but it seems that government is not doing good enough in supporting the public. For example, Pink Shack Estate. You only send over a small number of specimen bottles. Many queued up at the end. They couldn't get the bottle. And that will help to spread the disease. And it didn't just happen with Pink Shack Estate. It's the same with Kwai Lun Estate. You didn't send in enough bottles over. So did you do any assessment? For example, Pink Shack Estate, first confirmed case was 4 days ago, and 3 days ago, a resident managed to get a specimen bottle, and then it's only today that the resident got the result. And so the resident had to wait several days. The resident was concerned. The family members were concerned too. So it seems that the test results come out really slowly. There's no way you could tell the public sooner of the results. So the public really want to help the government. But then, for the list of buildings announced in the CHP website, there's very limited information. For example, there's a case involving Disneyland, and it says it's a non-residential premise. And a friend actually went to Disneyland on the very same day. He had meals at the restaurant, so that the friend would like to know when this infected person had the meal at the restaurant, and he had to, make much effort before he could find the information. So when you announce information, you give more details at what time and on which day the patient ate at the restaurant, and then the public would know whether they happen to be there at the same time and whether they might have come into contact with the confirmed case. So can you not announce that information as well? Otherwise, what you are giving out now as information means nothing. It's the same with the Panda Hotel case. You only say that the patient is waiting to be hospitalized, so everyone thought that person was still staying at the hotel, and they called me up, and then we found out, no, actually the person's been sent to the hospital, and the hotel has been disinfected already. So in providing information or updating information, can you give more details for the information of the public? Another question is about subdivided flats. The condition there is, of course, appalling. But then with the drainage system in subdivided flats, the situation is appalling too. I hope maybe the secretary or the buildings department could join me to visit the old districts, and you will know that the drainage system is all broken in old districts. But I reported a case a month ago. There's still no follow-up. And this is really worrying. What if there is an outbreak in a community? There's no way we could cope. So I hope the government would make improvement there and follow up on these cases. Now, on specimen bottles, maybe the CHP will answer that. Dr. Wong, thank you. For specimen bottles and for investigation of cases, we hope those who may have a chance to come into contact with a confirmed case would leave behind a specimen. But sometimes when people take the specimen bottles, they don't leave a specimen right away. They may take time to do so. But in any case, if they return the specimen bottle to our laboratory, the result will be out the same day or at most the next day. As for information on cases, when we have verified information, we will announce it in a timely manner.
I have a suggestion for you, the Secretary. It seems that the epidemic is never-ending. We don't know whether we will have a fourth wave or will there be a mutation. Some businessmen have factories in the mainland, and we have been making appeal for them. But I think the most pressing issue is cross-border families. One of the family members is working on the Hong Kong side, so that person needs to wait 14 days before he can meet his family, and then he needs to be quarantined for another 14 days when he comes back. There's no job that will allow that. Can we set up a subcommittee to discuss the possibility of allowing special exemptions, just one-off exemptions? Some people just have a newborn at home, and maybe his wife is sick. So we can adopt a humanized approach to approve exemptions case by case. We can set up a subcommittee to centralize the effort. Maybe we are just talking about 6,000 people. We can do it in phases and allow them to go back on a one-off basis to handle their business. Thank you, Secretary. So this is the end of this item. Thank you, Professor Sophia Chan and other officials for joining us. And then item 2, breast cancer screening. I announced that this meeting will be extended to 1 o'clock. So let's invite the administration to join us. We welcome Dr. Choi Dak-yi, Undersecretary for Food and Health, Ms. Leonie Lee, Dr. Rita Ho from the Department of Health, and Ms. Angel Fan from the Food and Health Bureau, Professor Gabriel Leung, Chair Professor of Public Health Medicine, Lee Ka-shing Faculty of Medicine from the University of Hong Kong, and Professor Ava Kwong, the Chief of Division of Breast Surgery, Department of Surgery of Lee Ka-shing Faculty of Medicine of the Hong Kong U. Welcome. Undersecretary, would you please walk us through the paper today? Thank you, Chair. On breast cancer screening, the government attaches great importance to cancer prevention and control. The Cancer Expert Working Group on Cancer Prevention and Screening under the Cancer Coordinating Committee regularly reviews international and local evidence and makes recommendations on cancer prevention applicable to the local situations. In October 2015, the government commissioned the Hong Kong U to conduct a study on breast cancer risk factors among local women under the research team led by Professor Gabriel Leung. In March, we have consulted the committee and reported the results of this study. We have Professor Gabriel Leung and Professor Ava Kwong with us today. They will tell us the major findings of this study. The revised recommendations made by the Cancer Experts Working Group are based on the study results. For example, recommendation of using the risk-based approach for breast cancer screening for women at moderate risk and the general population. There are revised recommendations as well. I'm not going to go into details. Chair, I will invite Professor Leung and Professor Kwong for supplementation. Thank you, Undersecretary. Professor Leung. Thank you, Chair. And thank you, Undersecretary. I don't have any particular details to add. I just want to say that this study is unprecedented in Hong Kong because we have 3,500 cancer patients data. These are real patients' data. And also we have 3,500 controlled patients. We have carried out an epidemiological research and analyzed it with a mathematics model to find out among local Hong Kong women what are the risk factors for breast cancers. After finding out the risk factors, we carried out a risk prediction calculation based on a math model. The Secretary is the chair of the Cancer Coordinating Committee, and and women are categorized into high, moderate, and low risk for breast cancer. The general population of average or moderate risk, what we are going to do to provide them with breast screening. We didn't have the data in the past decade, so we were not in a position to make recommendation for or against population-based mammography based on scientific evidence. But now we have the evidence among average risk women. About 1/4 have higher risk. And how do we draw the line? In the US and the UK, or Western females, their breast cancer screening scheme has a long history. They translate the age-based data into risk factors. For local Hong Kong women, after calculating this basket of risk factors, we can accurately target women of moderate to high risk. So the recommendation is for women aged between 44 to 69, they should be given biannual mammography screening. And this will effectively reduce breast cancer mortality rate. Because of the epidemiological characteristic for Eastern women, the mammography may not be as effective as compared with Western women. But with this recommendation, we can limit the possibility of false positive or false negative screenings. In the US and the UK, the government recommend screening for women about 44 years old. In the past few years, we have seen that locally, the incidence rate among people, among younger women, is high. And this time, we have local data, so we don't have to follow data of Western women. So we have presented the results in our paper, and we are happy to take questions from members and the chair. Professor Kwong, anything that you would like to supplement? I don't have many points to add because the summary has been included in the paper. So I will open the floor to questions. We have 3 members. Dr. Helena Wong. 3 minutes, please. Madam Chair, I welcome the fact that the government is finally willing to revise the strategy, the policy for breast cancer screening. For women with moderate risk, you are recommending them to be given biannual mammography screening. You have specified the age and the risk for this screening. This is a little better than the previous recommendation, I give you that. But the government is still not willing to draw a line in terms of age and encourage all women to receive screening. It is not a population-based approach. You're saying that women above age 44 have much higher risk than younger women, but the government is not taking a population-based approach. I want the government to explain why are you not encouraging women to be given biannual mammography tests on an age-based approach. This is what other countries are doing, like Taiwan. you are using the age-based approach plus the risk-based approach. And second, on subsidy, for women with average risk, they have some subsidy. For example, nulliparous or women who gave live birth at a late age. Are you going to provide a subsidy to these women? Because it may cost $1,000 depending on the type of mammography examination you are receiving. Undersecretary, are you going to subsidize women on mammography tests? Thank you for your question. The government's based cancer screening policies on the advice given by the Cancer Experts Working Group. We really consider that we need local data concerning the risk factors for breast cancer screening locally. So that's why we commissioned the Hong Kong U to look at a lot of cases to identify a screening method with scientific evidence and applicable to Hong Kong. So we are not just looking at age. There are a lot of other factors to identify target groups for screening. Under the Department of Health, we have been providing women health services for those who are financially who are less privileged financially. For example, the CSSA recipients and people receiving other subsidies, they will be given subsidies. That's my brief answer. Next question, Dr. Fernando Cheung. Madam Chair, the most important thing here is now you have a very comprehensive set of data. Like Professor Leung said, for women aged between 44 and 69, they have certain risk. You are saying that they have a rather low risk, so you recommend a biannual mammography screening for them. Many people fall into this group, and you have recommendations for women with medium to high risk. But the question is, how will these recommendations be implemented? The experts have given their recommendations, but many grassroots women do not have the financial resources to do these. For a 3D imaging, they are even more expensive, but they have a less likelihood for false positive results. So are you recommending 2D or 3D imaging? And what concrete plan do you have in implementing the scheme? For example, colorectal cancer screening program, you have a public-private partnership scheme and you have subsidy. So the program can be effective. Otherwise, if you are merely giving recommendation, annual test, annual screening for people with low risk, biannual screening for people with higher risk, that's just mere talk. For grassroots women, they have to work to make a living, and their working hours are long, so they don't have time and resources to do that. The breast cancer mortality rates among grassroots women are higher. You are clearly aware of this situation. So what are you actually doing to allow women with financial difficulties to get these screenings?
Now, perhaps I could give some information about services provided by the government at a women's wellness center. There's a fee, $220 for mammography and $310 for the screening. And if there are specified groups who could receive subsidy, for example, CSSA recipient there are other social welfare assistance recipients, and there are other exempted groups, and they could all receive the screening for free. Dr. Zheng talked about the effectiveness of mammography. Maybe Professor Leung or Professor Kwong could give a response. Thank you, Dr. Zheng, for your question. Now, when we talk about mammography screening, yes, Dr. Zheng is right to point out there's different types. Some are the more traditional ones, and some are more innovative. From the data we have, we want a hard clinical outcome. We are talking about the more traditional technology, because this relevant research has been done for a long period of time in the West. For the innovative technology, there is no hard clinical outcome, but maybe it's more precise, but can it really reduce the breast cancer mortality rate? Well, we don't have the outcome findings with us. But I must clarify that we just talk about mammography screening. It doesn't matter if it's first, second, or third generation screening. And then maybe there are specific circumstances. Instead of doing screening, there is the diagnosis, and ultrasonic diagnosis or MRI diagnosis may be done. But that's for diagnostic purpose, not for screening purpose. And then when we talk about cancer screening, we're not talking about examination. We're talking about screening. Now, since the 1960s, there have been data. Doesn't matter which type of cancer we're talking about. We want the coverage to be extensive. And you can see that around the world in different places. It doesn't matter what the financing model is for healthcare, but for the patient, well, perhaps it's actually not a patient, it's someone undergoing screening. The person, the purpose of screening is for the person to reduce all foreseeable, obstacles that may deny that person access to this service. So we need to remove those obstacles as far as possible. And Dr. Zheng is right to point out that with colorectal screening, there is a special subsidy scheme. In fact, in 2004, the Department of Health also issued a guideline on cervical swab tests, and so a database has been built up. But then it's not a subsidy approach like for colorectal cancer screening. And for the HPV vaccine is now out. So with some prevention of breast cancer, how do we do it? I think the guiding principle must be that for the general population, women in the general population, the obstacles to for their access to mammography screening must be reduced to the minimum. Yes, exactly. That's the point. You need to be able to promote the screening. Let's say a woman goes and see a doctor, and the doctor believes there's need to do the mammography. Then that cost is about $200+. So here we're talking about screening. It's not the case mentioned by Dr. Chui. Yes, I think the Bureau is aware of that. It's a matter of doing more promotion or even providing incentives to encourage grassroots women to take the screening. Now, may I seek members' views? Maybe we will overrun a little, so we may have to go just beyond the allowed end time of 1 p.m. If we go beyond 1 p.m., I will still allow members to ask questions, so we will extend the meeting a little longer. But definitely we won't go beyond 1:15. Any objection to that? No? Dr. Elizabeth Quat, please. Thank you, Madam Chair. On behalf of the Women Affairs Committee of the DAB, we've been fighting for breast cancer screening for the women. We've been doing so for the past decade. Today, the government is proposing this revised screening approach So for women of moderate risk or in the general population, which is to still receive mammography screening every 2 years, I welcome this measure. At least you're taking one step forward. But of course, what I would like to see most is, well, since you have already revised your recommendations, it's a matter of implementing it. Now, some women are reluctant to do any mammography, breast cancer screening, or any other types of screening. So for women at moderate risk or women at general population with relevant risk, how do you encourage them to take the screening? How can you give them subsidy? I think that's important. In the paper, there's mentioned that the Hong Kong University has a scoring tool, right? So people can check their risk level. Are you going to promote that tool? Maybe for women's groups and organization, the community, you can ask them to help you promote this tool, so women in all 18 districts are able to find out the risk level, and if the risk level is high or moderate, or if it's women in the general population but with certain risk factors, then they know they should do the mammography every 2 years, and that there is a subsidy from the government for doing that. It's like subsidizing colorectal screening, as mentioned by Professor Leung. So the screening is done every 2 years for free, and so you will encourage people to do it. And then when it comes to treatment and repeat consultation, follow-up consultation, there has to be a scheme to help people. Now, we know that with the mammography screening, if we use the traditional equipment, it's actually a painful process. But now there's a 3D imaging, where the government bring in the 3D imaging technology. So for women who have to do the mammography screening every 2 years, they will actually do so. The aim, of course, is for women to enhance their awareness. And so with early identification, there could be early diagnosis and early treatment, and it will save their lives. Who's to respond, please? Undersecretary. Thank you, Madam Chair, and thank you, Dr. Kwok. Of course, we totally agree that if we take that step, that is, we're going to update the standards for screening for different risk groups. And so we will publicize the message to the public and to the healthcare professions, so they will know what to do. Now, we have to look at the whole package, not just screening. The government has the responsibility to not just look at screening, but also possible need for treatment, and we have to look at the demands for equipment, personnel, and follow-up consultation after operation, and so on. So we need to review the entire approach, and that will take a bit of time. And also we need to help people know who are the high-risk groups. Perhaps there could be more information on the tool. I would like to thank Dr. Kwok for the question. Now, I don't have information on how the government plans to proceed, but if you look at the experience overseas, it's as I've explained earlier. First, there must be the awareness, and second, when there's the awareness, we need to expand the scope of screening as far as possible, or even for women in the general population. After risk assessment, there's a group with a relatively high risk, then this group must be able to access the mammography screening. Now, for mammography screening, do we use certain equipment like the newer generation equipment? and it would be the easiest and the least painful for women during the screening. Of course, it would be best if we could do that, and perhaps Professor Kwong could tell you a bit more about the equipment. But what is important is that people must not think that if they test a negative the first time, they don't need to do it again. They must do it every 2 years. Otherwise, it may give a false sense of security. People may think, well, okay, I don't have breast cancer, I don't need to do the screening again. No, it's not true. The screening has to be done on an ongoing basis. And the third point is, say, unfortunately, the screening result is positive. It doesn't mean that the patient has cancer already, because the risk remains low. So it's about doing a proper job with the second step, that is confirming the diagnosis. Perhaps Professor Kwong can tell you a bit more about the imaging results. Now, after the mammography screening is done, if the result is negative, the person must come back after 2 years. If the result is positive, then there are certain scientific processes we have to follow through. And if, say, there is a need to do a surgery, of course, we hope that the waiting time could be minimized. And actually, there is a precise surgery now, and there could also be tests to see after the surgery is done whether there is need for oral medication or radiotherapy and so on. So hopefully, in the new setting, we could do better in that respect. Now, before Professor Kwong speaks, can I ask the government this? I hope you could give an undertaking, because I'm worried after the report is out, the scheme will never be rolled out. So you need to have a dedicated scheme with dedicated resources, including manpower. And then you could put in place this screening scheme. When do you expect to announce to the public that the scheme will be rolled out? Can you give an undertaking, say, if the scheme could be rolled out this year? If you ask us to wait a few years, then really, then this report means nothing. Undersecretary? We will follow up further within this year and tell you what we're going to do next. So you will learn within this year what you're going to do next? Yes. Maybe for the next policy address or budget, well, you know what you need to do, okay? Dr. Helena Wong will ask questions, and then Professor Kwong could reply in one go, okay? I think we share similar concerns. Now we have scholars from the Hong Kong University doing the report, but they are not the government. As Undersecretary, you represent the government, you are here, and the way forward is there's no way forward. Honestly, this is the last meeting of the panel on health services for this term. And then you're telling us in paragraph 14, now, apart from the finding of study and the revised recommendations, you still have so many things to consider, say the capacity of healthcare system with respect to resources, manpower, and whether screening does more good than harm. You're still asking that question? If you haven't thought the question through, why did you ask experts to do the study? I'm an academic, I know. So we do all the work, and at the end, you're still going back to the first question, whether screening does more good than harm. So you haven't even got an answer for that, and then you say, we see if there are enough resources and manpower, and whether there's public acceptance and so on. If that's the case, why bother making the Hong Kong U team do the study? Now the experts and the scholars have done the study, but the government has not committed to anything. You haven't convinced yourself whether screening does more good and harm, and I think that's that your attitude is doing more harm. So it doesn't matter how good the study findings are, you are wasting people's effort. Now you're saying that you agree, all these measures should be done, but then you are not implementing them. And then when people ask whether there will be subsidy, you say for CSSA recipients they will get subsidy. But what about those not receiving CSSA, but who are still grassroots women, so they get nothing? Now, when did the Hong Kong U submit this report to the Bureau? Can you tell us, Professor Leung? Can you answer the question, when did you submit the report to the government? Can you give us the report? Dr. Helena Wong is just only criticizing the Undersecretary, not you. Well, I'm sure they know, because I've been a scholar myself, so I know exactly what it's like. Let me clarify. Now, we have completed the preliminary report at the end of 2019 for this study. Now, for study like this, we have to give an interim report to the government every 6 months. So we have completed in the preliminary report, and after that we have given report to the government. But for this preliminary report, because in the first half of 2020, that's the epidemic. So we have not finally completed report, because that means we have to go through a certain process. Originally, we hoped to complete the report in the first quarter of 2020, but as we were about to do so, the epidemic came about. And so we told the government at the first instance that we should still come back to the panel. That's why I thank you for giving us this opportunity. So you haven't actually submitted the final report to the FHB, but then the essential findings are there, right? It's just about polishing the report, right? Yes, because now, as well, the epidemic was about to stabilize, and so we were about to start finishing report. But now there's a sudden turn in the epidemic, and as some members said, when with the risk calculator, we need to work on the interface so it's easy to use by the public. And now we are doing that last stage of the work. So when the epidemic stabilizes, we will be able to complete the report. Please submit the report not just to the FXU but also to the Legislative Council. It could be uploaded to the the web page of the Health Services Panel. So during the summer we could still read it. Now, by the end of 2019, Undersecretary, about the essential findings. There is already dragging on for 6 months, and you have to drag on another 6 months before you can announce the way forward. But I think you're acting too slowly. Everybody's busy. You're busy. I'm busy, but you can't just keep dragging your feet like that. Can you speed things up a bit, Undersecretary? Oh, as we mentioned in the paper, within 2020, we're going to announce further details on the way forward of breast cancer screening. Now, Dr. Wong referred to the key reference factors in paragraph 14. We're talking about the considerations for cancer screening as a whole. But for breast cancer screening, we know that Hong Kong U team has come with recommendations on improving the screening approach, so we definitely go by those principles. But at the same time, we believe that as we make these changes, it will involve many different parties. That healthcare professionals need to know what tools are available, and public. Can you give a time frame? Within 2020, announcement within 2020. Well, that's quick enough. So they can do within 6 months. I'm really, I really feel uneasy reading paragraph 14. You say you have to look at whether you have the resources, manpower, infrastructure, and so on. So can you answer my question? Very often, the government resists screening of any type, for osteoporosis and so on. And you always resist screening. Is it because of resources? Are you worried that with screening, then more cases will be identified, and then maybe on the oncology departments of the hospitals will be under much pressure? So that's why you rather not do screening, because after screening, more cases will be identified, and then the waiting time will be even longer than 2 or 3 years. Is that your underlying concern? But the purpose of screening is early identification and early treatment, right? That's why the government is is promoting primary health care. That's the whole philosophy. If you identify problems earlier, you can help people earlier, and you're able to reduce the mortality rate. But now all of a sudden you're saying that you are worried that with screening, then you'll find problems with people, and then we don't know if the hospital authority could cope. Maybe $70 billion won't be enough. Maybe hospital authority would then need $80 billion. So I don't know what you have in mind. Now you are. Of course, you will identify cases sooner, but then at the same time, you save resources, so people don't have to be treated at a later stage, and when treatment becomes more expensive, and then the cancer may not spread to other parts of the body. And when, of course, if you're not able to save lives, how much does a life cost? How do you work that out? Undersecretary, you want Undersecretary to work it out now? No, you can't work it out. Life is is worth much. Now, I'm a woman, I agree. Of course, there is need for early identification. Why did we carry out this major study? Because around the world, it seems that people are trying to shy away from screening for the entire population. With screening, of course, we could identify early stage cases, particularly so with breast cancer. But then at the same time, we understand that sometimes even for very early stage breast cancer, it has nothing to do with survival rate. So that's why around the world, there's this phenomenon of overdiagnosis. Okay, maybe you're able to identify very early stage cancer, even 0 stage cancer, but does it really affect the survival rate of the person so much? So this is something we debate in this specialty. Now, I'm glad to do this study because around the world, we have come to realize that we ought to screen moderate to high-risk groups, and then we could achieve the objective of improving survival rate. So why did it take some time to do the study? It's because we wanted to have local data. For Chinese race and Westerners, there is a difference in the genetic makeup, so there's a difference in breast cancer as well. Now, so I wanted this to be done soon. Now, I work at the hospital authority myself. So if we want to implement the screening, that we have to go through certain mechanism. I'm in that department myself. Just now there's mention of 2D, 3D imaging, which type of equipment is better. The new type of equipment would be for 3D imaging. There's data for the older generation equipment. There's no way we could still buy the older generation equipment. I'm a user of this equipment myself. In the government, when we are to update our equipment, there is a process to follow. Maybe tomorrow, all of a sudden, if you want 5 centers to be able to do the screening, it will be difficult. But within 2020, can we then finalize a plan? Now, I'm from the specialty, and I believe that is achievable. And if we could take this step, that means we are going with the world trend, because around the world, we start to agree that we need to do screening for high-risk groups. Only then could we help them to change the outcome.
Anything you would like to add, Professor Leung and Undersecretary? Nothing, Madam Chair. I can feel that the administration and the experts are very eager to provide screening for more women. If our Treasury allows, we should be able to give a subsidy to women for screening. Like the Undersecretary said, it should be implemented within 2020. So members from different parties should work together towards this goal. This is the end of our meeting, so I'm sorry there has been some delay because the previous item was many members' concern. This is the last meeting for this electrical session. So thank you for your support on our work. Thank you very much. Meeting is adjourned.